Okay, well, welcome to another episode of the Practice X Factor. Thanks for joining us. We have an awesome guest on today, Julie Seager. So, Julie, welcome to the podcast. Thanks for being here today.
Thanks for having me.
Yeah, so Julie's been a practicing hygienist for 28 years. She's a member of the American Academy of Oral Systemic Health. She's also been with XLEAR, right? 11 years, is that right?
Almost.
Almost
Yep.
11 years, cool. And she maintains private practice in Sacramento, California. So she's well-versed in everything, hygiene, prevention, oral systemic health, which is great. And, you know, listeners of this podcast really kind of targeting practice owners who want to build a greater relationship with their patients, offer membership plans and things that help patients seek them for reasons other than insurance. So we are an insurance-friendly podcast, but we help practice owners find ways to differentiate themselves so they don't have to be insurance-driven. So thanks for being here. So great to have you. We've, you know, your introduction to me is fairly new, but we've been working with XLEAR for, gosh, I think probably 8 to 10 years. We did a couple things with ABC News around our Halloween candy buyback a few years back, 2 different times with XLEAR, so that was fun. So anyway, thanks for being here. Anything else to add that you think may be helpful for listeners about you or what you'd like to share?
Just, you know, I'm just so passionate about these products. It's a product, the nasal spray product, the XLEAR line, is something I used as a consumer before I even went to work for this company. And it's literally changed my life, because when you can go from not breathing to breathing, you know, that's always a good thing. And I've kind of taken that, my own personal experience, and I've just developed a passion for learning about airway and about how we can make patients' lives easier in and out of the dental office by using XLEAR products with the patients, you know. So I've done extensive continuing ed on airway management and things like that. So that's my little niche within
cool.
hygiene. Yeah.
Well, that's pretty cool. You know, I mean, when we have hygienists come into my office and we go, hey, on their hygiene exam, we're taking like a Malum-Patty airway score. A lot of times hygienists are like, what are you talking about? You know, those are words that are like, I don't remember that in the dental board exam, you know.
Right.
but it's pretty cool, and we found, you know, we have networked with some family physicians, OBGYNs, sleep physicians. I mean, don't you think, like, as dental professionals, there's a lot of opportunity in working with other healthcare professionals? There's almost like this kind of separation where, you know, it's like, oh, go find a dentist, you know, to the doctor. Or the dental office might be like, you need to go see a doctor. But we have a lot of patients, they see us more frequently, they're physicians. So it's kind of fun when we go, hey, you need to get some blood work done. You need to get in, you know, get a physical. You need to get a sleep test, those kind of things. I mean, what have you seen, you know, is opportunity there, or things that are working well for you in working with other healthcare professionals that might make practice, you know, patients will be more happy with the practice when they go, you know, thank you so much. You know, you got this sleep test, and I can't believe, I mean, it's changed my life, changed my marriage, all those kind of things.
Yeah. Yeah, no, it's incredible. I've seen incredible things come about, but you're exactly right. It's not just that we need to have a team. That's a team of healthcare providers, everybody, you know, from pediatric specialists, ENTs, and, you know, endocrinologists even, you know, for patients. But if I were a dentist and I were able to, you know, establish these relationships on my own, one thing I would look for is that you've got to have people with the same common thinking, the same knowledge as you do, the same knowledge base. And so it's important that, you know, you guys all get together, you know, and sit down and powwow about this and say, okay, you know, why is this happening? Why is this patient, you know, breaking their teeth? You know, and it turns out they need nasal surgery. But what are you going to do with the patient until they can get that taken care of? And it's a whole team approach, you know, and it can just be life-changing for people. I've heard so many testimonies. So like I said, myself included. But yeah,
right.
If you want to make your practice patient-friendly so that word gets out about you're the doctor who cares about the entire body, you know, the oral systemic connection, you're not there just to keep them in a state of disease or just repair mode, you know. What is it? What do they say? Drill, fill, and bill?
Right.
That is such antiquated thinking. And in this day and age, there's no reason to practice like that. You know, it's really interesting, when I do a lot of presentations to dental components and, you know, or associations and things like that. And when I'm going over the research, the early research that was done on xylitol and decay prevention, and, you know, I show them the evidence, like, look, this can prevent 60 to 80% of new decay from forming when it's used on a consistent basis for such an amount of time. You know, sometimes when I've been with an office manager group or dentist, crickets, you know, they're like, oh no, this is going to reduce decay.
Right.
But then I'm like, you guys, okay, you're still going to be doing endo, veneers, crowns. People are going to break their teeth. You know, people are going to want aligners. They're going to want bleaching. You're still going to have hygiene going. How much of your practice is actually decay reduction, you know, or filling decay? So a preventive product like this, what it's going to do is make your patient's experience in the dental office easier, because if they can reduce their calculus, reduce their inflammation, xylitol reduces inflammatory response. People don't know that very often. They're going to come in, they're going to have an easier appointment. They're going to have a faster appointment. Nobody wants to hang out with us more than they have to, right? So your hygienist will be happier. She'll be, you know, less tired, less stressed out. The patient will be in and out faster. And, you know, they're going to be like, hey, you know, why don't you go to Dr. Williams? When I go there, it's an easy appointment. Or my kids are going there and they're not even getting cavities anymore. You're going to be known as the doctor who promotes wellness. And that's appreciated, you know, instead of just somebody who takes the money and runs.
Yeah, and we use the XLEAR products a lot, like for our patients who are on our membership plan. When they come in for their preventative visits, they get free refills on toothpaste or mouth rinse. And they like it because it's something different. You know, it's like, if you send a patient, if you say, go get this toothpaste, and they go to the grocery store, there's like 2,000 options, and the one you send them for, they're not going to be able to find. They're going to get something else. You know, there's so much preservatives and other stuff in a lot of these shelf products. And, you know, on the other hand, if you take this to like a lot of corporate dental offices, they're not going to want to listen to this either, because they almost see hygiene as a loss leader to get patients in, to drill, bill, fill, right? And there is a group of people who want that kind of cheapest, lowest cost, only what insurance covers. But for people like you and I, and a lot of our patients, they want something better. They don't want to get on the drill, bill, fill treadmill and be like, why is it every time I come in, I got 28 more cavities? I didn't even know I had that many teeth. And I've been coming in every 6 months for 4 years, and they feel like, you know, the dentist is just buying a new boat every time the hygienist. But then you look at, you know, the Scandinavian literature where xylitol is coming from, and it's like, well, they're getting probably less cavities overall than we are in the U.S., where we're supposed to have the best health care. We have so much corn syrup, so much preservatives, sugars everywhere. And so, you know, I've been on board of the xylitol bandwagon since I heard about it in dental school. I'm like, why is this not, like, talked about more? You know, and still people are like, I've never heard about this. I didn't even know this was a thing. So what do you see as, like, what's helping get the message out right now? You're big in education and, you know, spreading the xylitol gospel. So what do you see working well?
Well, it's been amazing. You know, in the last 5 years, our sales have doubled in the entire company. So that's huge. It proves that our education method is working. There's 3 of us that do this position, this educator position. My coworker is Lisa Stillman. She's in the Mid-Atlantic and Northeast. And Rhoda Kuplikis, she's based in Florida, and she manages kind of the Southeast and over to Texas. 3 of us combined, at least pre-pandemic, we're going to 50 to 60 medical and dental shows a year, interacting with dental professionals as well as nurses, nurse practitioners, PAs, ear, nose, and throat doctors. And it's just getting the awareness out there. And it's so funny because once people know about it, they're hooked. There's nothing like it. You can't argue with it. Even it's funny, if you go on Amazon and read the reviews, like for the XLEAR nasal spray, there's 23,000 4.5-star reviews. These are not coming from dental professionals or for
right.
These are consumers, and so they're learning about it from the healthcare providers. So the knowledge that you can give your patients is, you know, sometimes we think it might go in one ear and out the next, but, you know, when they walk through CVS and see the product, they'll be like, oh, yeah, I remember. They told me about that. Okay, I'm going to try this, you know, or, you know. But it's really amazing what the word of mouth has done. You know, when we work on writing articles, getting things published, YouTube videos, different things like that. Different organizations we work with will call on us to maybe present a continuing ed class one night or webinars or things like that. So.
Wow, cool.
We're busy.
Well, yeah, it's a good problem to have, right?
I love it. I love it so much, though.
So when you're going to these trade shows, I'm curious who's, you know, which kind of healthcare professionals do you see as most receptive to this? Which ones are kind of maybe like, I don't know about this, you know? Is it hygienists are receptive? Dentists maybe dragging their feet, ENTs? What do you kind of notice the patterns?
It's interesting. When we go to medical shows, we in the past have focused on our nasal spray product line because we think, okay, they're treating people with colds and flus and ear infections and things. But it turns out that audience tends to be more interested in our dry mouth relief aspect, our dry mouth products. And they're like, oh yeah, this is a good nasal spray. Oh yeah, I've heard about this. A lot of times they already know about it. And the dental audiences, sometimes they don't even know we're the same company, XLEAR and Spry. Mm-hmm. And they say, oh, okay, I just heard a speaker talking about this, and they'll come over and they go, oh, this really makes sense. Can you explain this to me more? Where can I find this? And, you know, they'll take a sample with them, and I'll tell them, you know, I'll say, you know, let me do a webinar for you, and I'll teach you the little tricks of how to use this with your patients so they have a better patient experience in the office. You use this pre-procedurally, and they say, oh, wow. You know, so we kind of start to get people thinking outside the box of standard patient care that we learned in school. You know, it's really great because people will, they're frustrated. A lot of healthcare providers are frustrated, you know. It's in dentistry, we get frustrated because our patients are not compliant, and, you know, our work will sometimes not last like we want it to. You know, and in the medical side of things, look at the frustrations they have to deal with, you know, as talking to people about their blood sugar or whatever, where xylitol comes in handy for that, you know, or airway maintenance where the XLEAR can help with that. But they want to get their patients to a baseline of health. And if they can incorporate this in, it's going to be just one less medication they have to prescribe. And get them thinking outside the box, and it's just going to help their patients. They'll be more compliant, you know.
Well, and what a great opportunity. I mean, so many patients have dry mouth, and it's amazing to me how many people don't put that together on the damage that does to their teeth, you know. It's like they realize that their mouth's dry, but they don't always tie together on their own. Hey, dry mouth means your teeth are going to lose minerals, they're weaker, your teeth are going to be more sensitive, your gums around your implants are going to be harder to maintain and bleeding. So, you know, one thing that's helped us a lot is really helping our patients kind of talk through, hey, you have dry mouth, here's a protocol to use, and that's where, you know, a hygienist who's really looking to have a great patient who likes them because of the results they get, not just because they take their insurance, to where you can really stand out and kind of wow people, right?
Yeah.
The practices that are just herding people through like cattle, they're not going to have time to do this. They're not going to make time to do this. So it's important, if you're trying to stand out, that take the time to educate your patients, have pre-printed handouts you can give them. We have a little card that our hygienists fill out. It's kind of like a report card, and the hygienist can make notes and the hygienist's name. And that way the patients have a certain person to call if they have a question, because I don't think it should be every 6 months, especially with your membership patients. It's important to make some things that are different than insurance. And, for practice owners listening to this, we'll put things like a, free consultation with a oral surgeon or with an orthodontist. Probably something that the referring orthodontist is going to do for you anyway, but when you list it as a benefit on your membership plan, you go, hey, look, this patient has a narrow airway. They might benefit from an expander because they're young enough and they're getting dry mouth and, chronic sinus issues, and you can give them some xylitol products to help manage it in the meantime. I mean, you can really change someone's life, not just through veneers and they smile, but like their day-to-day things that are annoying them, dry mouth, chronic sinus issues, a lot of things that you mentioned you really are going to help people learn about, find about, right?
Absolutely. And I have to throw this in too, because, and I learned about this from a hygienist who was an oral cancer survivor, and this was her protocol. She told us about it, was that she found really, if you want really profound dry mouth relief, I'm just going on a clinical note here, that the XLEAR nasal spray is an integral part of that. And people think, well, why would I spray my nose for dry mouth relief? It's because, it's all mucosa, top to bottom, right? And the nasopharynx mucosa, the back of the throat, this is just as dry as the mouth is. But nobody's ever come into you and said, Dr. Williams, my nasopharynx is really dry today. But once it's hydrated, it will help the rest of the, everything work together more profoundly so the patient can have better relief, longer lasting dry mouth relief. But yeah, I just had to throw that in.
No, I think it's great. I mean, when you got a periodontal patient who's got gum disease and you're working around that wisdom tooth, I mean, you're just inches away from that nasopharynx and everything else. And I think we could do a better job, integrating with ENTs and oral surgeons and dentists and hygienists. Like, hey, we're all just inches away from each other. There's a lot more connected there than we give credit to sometimes, of like, hey, it might be good to get another set of eyes on this, both directions, to really make sure the patients feel better. You're getting rid of TMJ pain, dry mouth, wisdom teeth, gum disease, breathing, airway. I mean, all that stuff is so tied together, don't you think?
Absolutely. And we're the ones that are really, we're the ones looking at orofacial development, hopefully. We are going to be able to assess the patient's posture and things. And, when you get the nasal passages open, you're going to get head upright, better posture, nasal breathing. It's going to affect their whole, the whole musculature. But if you can especially get to this when they're children or when they're teenagers and this orofacial development is still malleable, like you said, maybe somebody needs an expander, this is just going to go right in line with that. And what happens is when you use the XLEAR nasal spray products and the Spry dental care products, is that you get this communal microbiome that's healthy. So it's not just, you're spraying your nose and washing your nose, that's great, but what have you got going on perio-wise, or what's growing on your tongue, and vice versa. They talk to each other. So that this is why it's really like a system. If somebody can be using both lines of product, they're going to have just a healthier overall result, overall microbiome.
Yeah, we had a patient actually recently, really bad lichen planus in his mouth, and he's had to take a bunch of steroids and antibiotics, so it's just made it worse, for other problems he's had. So his mouth is just so disrupted.
Yeah.
And he'd been going back and forth between us and the dermatologist, trying all these different topicals, medications for like a year, and we got him on a xylitol and a probiotic, oral probiotics that he's using daily. And he was like, hey, this is the first time. He's like, I actually put some weight back on. Food's enjoyable again. I can taste chocolate. I can enjoy a sandwich again. I can actually taste it. It's not burning my mouth. And he's not out of the woods yet, but it's like sometimes, when you just try to put weed killer on a problem that's already bad, it's just flaring it up worse. And there's a lot more, ways to kind of holistically look at the picture and go, okay, well, let's think about what we've tried, what we haven't, because the goal of this, podcast is to say, hey, how can I take a patient and have them be a lifelong patient? We know people move, they die, they change jobs, things happen, but, we have patients and you have patients, I'm sure they move away and they come back and they seek you out because they remember how they were treated and they're not looking for, the coupon in the mail, and they're not running straight to ask their insurance company first. Their first thing is, hey, Julie was an excellent hygienist. She helped me with my dry mouth. She also helped me with clearing some of my sinus issues that I didn't even think I was going to get at the dentist. And, not only that, but she gave me some samples while I was there, whatever. It's like, wow, that's totally unexpected. That's a wow kind of treatment that people weren't even coming in for. And not only did you give them a good bill of dental health, but you knocked some other pins down of problems they were having in their life. And it's like, I'm going to call you first, even before my doctor, even before my physician,
Yeah.
So what do you have experiences like that? Anything or at other offices you work with?
All the time. The office that I'm at now, I've been with the last 18 years. And we have a really unique patient population. Most of our patients are new to the U.S., first-generation citizens. And so they come with a unique set of challenges a lot of times. But, I get an hour with them. And I get to look at, like I was saying, oral facial development, dry mouth, Mallampati score. And I get this opportunity to just talk with them. And every day before I go in and see patients, as I'm driving in, I'm like, hey, I set my intention for the day and say, what can I use? I've had so much opportunity from XLEAR to attend amazing conferences and hear the latest cutting-edge research, not just on airway, but decay prevention and everything. What can I do to bring this to my patients? And they recognize that. And that's why I have, and every patient has the list of, Julie patients and things like that. But there's patients you just connect with and appreciate that you are going that extra mile and not just doing the quick cleaning in and out so that you can, go chat on your phone for 15 minutes before the next person comes. So.
Right. Yeah. Well, yeah, and what's interesting, so how did you kind of fall into this, treating this population? Because not only are you teaching them about, some of these people have probably never gone to the dentist regularly, right? It's a whole new, just going in every 6 months or every 3 months is a whole new journey, right?
Yes.
How did you kind of get into this type of practice where you're working with this group of people, and what kind of things do you see internationally that maybe people are aware of, like eating healthy versus, avoiding processed foods? Is that kind of already instilled in them? What kind of hygiene practices do you see, and what kind of things are you really kind of helping people out with? Because a lot of our listeners are in, big cities or urban areas where you have diverse populations.
Yeah.
We get lots of people where I'm at from India and Pakistan. A lot of them are software engineers that contract with a few of the companies around me. And so, a lot of them will have very little decay issues. They're eating maybe a more indigenous, natural diet, but we'll see a lot of gum disease because they haven't had, some of these people haven't gone to the dentist regularly. So what do you see kind of pluses and minuses when you're working with this group?
Yeah, it's interesting, the different, you know, the different regions people come from. They have unique characteristics, and I think sometimes, you know, it can definitely be genetics too that will be contributing. But I fell into this just, I had moved out of state when I came back to Sacramento in 2003. I just started temping, and the temp agency had me go over to the practice where I'm at now. It's Luis Mendez in Sacramento, and he's amazing. He's from Mexico, and his dad was a professor at the dental school there in Mexico City, so that's where he went. And he got married and got his license here in California, and he's been in practice a very long time. But our patients come to him because he, you know, he can speak with them very easily, very clearly, but also, you know, he reserves judgment. And he, you know, they have a treatment plan a mile long a lot of times. And he's so realistic, and he's just like, okay, you know, we're going to do what we need to do first. And, you know, we'll do some this year, you know, and it's just different. It's when I hear these consultants say, oh, if somebody has a 4mm pocket, they need root planing. I'm like, no, that's not how I practice. You know, ideally that would be great, but you know, it's very different. I call it like triage hygiene sometimes, where, you know, we just go in and do what you can do.
Mm-hmm.
And
but that way you're getting trust. You're getting trust with these people, so they want to come back. Because people, you know, the first time they come, I mean, it takes, wouldn't you say, at least 6, maybe 18 months to really trust a provider that you're working with, depending how many times you're seeing them. But, you know, a lot of times someone comes to your office and it's all new, or maybe they had a bad experience, so they're kind of looking for another point of view. And if you just like tell them they have to get all this stuff done now, you know, on the flip side of that, I've worked with offices where it's almost like supervised neglect too. You know, like, yeah, you got some stuff, we'll talk about it later, and not informing. So I think there's that sweet spot of, hey, here's everything you have, you know, what would you like to do?
Yeah.
And a lot of times you just listen, the patient will tell you exactly what they want. They're not going to use words like pocket reduction and crown, you know, but they're going to say, well, if I have cavities, I'd like to hear that, and, you know, if the gums are bad, you know, and so you go, okay, look, here's what we're going to do, and then we'll do the rest of this stuff down the road. Is that kind of what you're thinking? And they kind of say, yes, that sounds great. And then you know that that's a bigger hurdle than even the exact cost most of the time. It's just they want to be heard and listened to like all of us do, and know that you've connected, you've listened, and now you have a patient. They're going to come back again and again, and you can work through that plan. But it can be overwhelming for people when they're like, I have nothing hurting. You know, I came in here, nothing hurting, and you're telling me I need $18,000 worth of work. You know, that's a fast way to lose a patient.
Oh, yeah. I tell you, it could be so easy to do. But, you know, there are people from other cultures, they just, even, you know, when I've worked with people from Europe, and you think, you know, they've got advanced, you know, very advanced dentistry over there. It's just not the cultural value that we have grown up with here, where, you know, you go to the dentist every 6 months, and that's what you do, and you've done that since you were a kid, and then we have school programs to teach you how to floss and give you fluoride. It's getting this value system instilled into patients from other countries, and I think the membership plans are awesome when it comes to that aspect of it, because it's like, we'll just take care of this for you, you know? Here's your plan. Come on in, let's do this, and hopefully you're not going to need a whole lot done every year. If we only need 2 or 3 cleanings, that's great. And, you know, you're using spry products, so you're going to go from root planing to, you know, down to, in a year and a half maybe, you're going to go down to a 6-month recall. So it's going to be easier for the patient, but it's going to end up, in the long run, profiting the office who has a membership plan, because the patient's not going to need as much work. But if they can get this instilled in their value system as part of like, okay, this is just how we do things here, you know, could be profitable for both parties.
Yeah, and then you're not, you know, limited. Oh, well, I got this plan. I can't get a crown for 2 years. So I'm just going to take the tooth out instead. And you're kind of like, well, that's not a, and that's the nice thing with membership. You can really cater towards what your patients want and then give them what they need. And, we do a lot of surveys on patients to go, okay, our internal patients say, here's what they want. Here's what they like about the dentist. Here's what they don't like. That's the magic formula to go, okay, I know just how to build my membership plan for what people want, not, you have to come. I mean, most people listening probably don't know where the 6-month cleanings came from, but prior to insurance companies, there was an ad for Pepsodent, and he would say, Claude Hopkins, this brilliant marketer, was like, brush twice a day with Pepsodent and go see your dentist twice a year. And that's like when mint toothpaste was new, there's original flavor before that. If anyone's ever tried original, it's terrible, like original Listerine, it looks like turpentine. And you're like, why would you do that? But that was the thing. And so Claude Hopkins has this brilliant marketing campaign, very successful. And all of a sudden it's like, oh, well, now we need hygienists and all these other things. And people just adopt it. Well, twice a year, if you cut that year in half, that's every 6 months. But that's not the right recipe for a lot of people.
For most people. Yeah.
And it's like, I mean, I've never been diagnosed with gum disease, but I go in every 3 months and get my teeth prophy done because I see enough problems. I'm like, why wouldn't I? There's no reason that I wouldn't be an example to my patients and team of like, look, I'm doing this because I want to do it, and I always have the hygienist put the varnish and everything on for me because they're always like, hey, do you want to put this on your own? I'm like, no. I'm a normal person too. I'm not going to do some of this stuff on my own.
Yeah.
I'm here to have you do it. And, one of our membership plans we offer, people can even come every month if they want for a touch-up polish,
Oh, I love it.
A lot of people don't use it, but it's just there to go, okay, look, if you want to come in and you have an area that's hard to clean and you're always getting plaque, come on in. We'll take 20 minutes and we'll touch that area up and, people feel happy. And it's like, it's not hey, you have to fall into this category where it's, you have to come twice a year because, you see these offices, you see them too, where they're just prophy in their teeth and there's big black shells of tartar in the gum. And you're like, and the patient didn't even know. That's the problem. They weren't even informed about it, So,
yes, I do know.
yeah, you see those. You've seen more of those than me. 28 years.
Oh,
you've seen more of those than me. What do you see as kind of the, what's the next thing that you're going to see with xylitol or, preventative? I mean, what kind of things do you see right now that are maybe incubating a little bit? It's like, hey, this is going to help really move us to the next level on systemic health.
We've got a game changer that just came out in the Spry dental line that it's been in the works for a few years, but it just launched this fall, and we've reformulated our toothpaste, and it's now it's trademarked Enamel Max, or copyrighted. I forget.
Cool. I'm gonna write that one down.
Yeah, it's Enamel Max is our new. It's reformulated, so it's not like you can go in and you're going to find 2 or 4 different kinds of Spry toothpaste. But what they've done is they've added TMP, which is trimethaphosphate, and what that does, it helps to incorporate the calcium and phosphates that are naturally occurring in the saliva that may be hanging out in biofilm that doesn't get cleaned out, and it will take those and drive them deeper into the tooth, especially when there's fluoride added to those.
Cool.
Xylitol on its own is a carrier for minerals. So when you have that, 25% xylitol plus the TMP, you're going to get this really amazing mineralization effect. And
cool.
Then the other thing that they added was arginine. And arginine is like nothing else out there. It's only been available in the professional realm. I know I've used Colgate Pro Relief for my patients to polish root surfaces for patients that have, exposed root surface sensitivity before cleaning. But now it's available to the public in our toothpaste. So we've added arginine. It just blocks over those tubules like you've never seen before. It neutralizes the pH. You've got the TMP, the fluoride, 25% xylitol, and it tastes good. It's not full of chemicals. You know, there's no sorbitol in it, that's a 6-carbon sugar increasing plaque, and it's just fantastic. Now you can recommend one toothpaste that's going to fight cavities and sensitivity at the same time. So that sounds a little bit like a commercial, but I guess I get so excited about it because it's...
Hey, you've got a nice smile. You could be on a commercial, you know.
Oh, thanks. It's
been
a lot of time at the ortho office, yeah.
Yeah, right. Well, that's cool.
So,
I didn't know that, but that's, you know, if you just, there's people to use this stuff, and I think TMP, wasn't there a product, MI Paste or something that a company had years ago that had something like TMP that was only applied by the professional, right? Or something similar, but you're saying now that's basically in the consumer toothpaste.
It's in consumer, yeah.
Yeah,
so,
cool.
Yeah, MI Paste was amorphous calcium phosphate.
AMP, okay, all right.
Yeah, and CCP. So, yeah, same principle, but, you know, one thing and I love MI Paste, that's been an amazing contributor to the dentifrice arena, but you know, people with milk allergies can't use it, so we've got to work around that. And so this is a toothpaste that can just be very user friendly. So
well, I've used the Spry toothpaste because I've had a lot of friends and family like, you know, I got to use this weird toothpaste because I'm allergic to,
yes,
you know, the mint. They always say I'm allergic to mint. I'm like, I don't know if you're allergic to mint. Try this stuff. You know, I'll give them like a spearmint Spry. They do just fine.
Yeah.
You know, I haven't had one yet that was like, oh, that irritated my mouth. You know, it's mild, but I just like those products where it's like everything else, consumers want things where all the weird ingredients are stripped out, you know.
Yeah.
And some people say, if you can't pronounce it, don't say it. But I promise there's stuff in Spry most people can't pronounce, but that's just because it's a big, long, you know. I think that's a little kind of extreme to say. If you can't pronounce it, don't put it in there. But you can research these ingredients and, you know, hey, this is something that's been thought through. Hey, here's something that's gentle you can use every day, you know, prevents that kind of thing.
Yeah, and those patients they're allergic to the sodium lauryl sulfate, which, you know, again, we don't have, which a lot of natural toothpaste still have that.
Yeah. They sell out and then they start adding that stuff in there anyway, you know.
Yeah. Yeah.
So.
And the other game changer is the XLEAR nasal spray. So, you know, once the research, especially the last 2 years when we started learning how it's has this virucidal property to it and how it blocks the adhesion of viruses now, it's been flying off the shelves. So
cool.
That's the other game changer in xylitol as far as, you know, we've got oral and then upper respiratory. Yeah, it's all.
Well, I'm thinking, you know, so many patients, you lay your patients back and you put a rubber dam or an isolite or a dry shield or even a suction. You know, they're coughing, they can't breathe because their nose is blocked.
Yes.
And if you can help get your patients breathing easier, sedation's easier, all the dental work's easier, hygiene's easier, because if they're a mouth breather and then you plug their mouth up, you know, they got nowhere else to go to get that oxygen in there.
I'm glad you said this. It's one of my big points that I really talk about when I do a CE webinar for somebody, or, you know, if I'm talking to an association or something. And it's like, look, you guys, how many patients have you had gagging in your chair for impressions, x-rays, ultrasonic water, rubber dams, you name it. And if you can provide something that in 3 minutes is going to give them 20% more airflow volume, they're going to be able to relax. You're going to be able to get the procedure done faster. They're out the door faster. And again, they're happier because now they can go pick the kids up from soccer practice and, you know, get on with the rest of the day. But yeah, it took me 20 some odd years of practicing before I figured that out, that that's why people are gagging, because they can't breathe through their nose. So we have these little mini bottles of XLEAR. You've probably seen them. They're teeny tiny. You can get 3 or 4, maybe 5 uses out of them. But I give them to my patients before the procedure if I know it's somebody who tends to gag or choke on the ultrasonic water. I'll say, spray your nose with this. I'll be back in a few minutes. Literally in 3 minutes, there's research that shows that 3 minutes, 20% more airflow volume.
Cool.
changes everybody's experience. Patients are happier.
Yeah.
You say, hey, go to Dr. Williams. It's easy. It's easier when I go to him. I can't tell you why. It's just easier.
Well, I'm gonna have to try that for sure, because we have a lot of patients who sorry, I gotta fix this little pop up here that's showing up. We have so many patients who, I always say, like, when you're sedating a patient, that's the best. That's like a sleep screening, because they're lightly sedated and they start to snore, or you'll see them kind of stop breathing for 1 or 2 seconds, and they go, sorry, I dozed off. And it's like, does that happen all the time? And so that's like the easiest way to refer. I'm always telling my sleep physician friends, like, talk to the dentist you work with and be like, who do you sedate that snores?
Yeah.
They got a problem, But I'm gonna use that before our mouth breather patients, before we do a procedure next time. I'm gonna try that out and have them use that nasal rinse and see how it clears things out so we can get the job done.
Yeah. I use it all the time with my hygiene patients. I shouldn't say all the time. Probably several times a day. I'll give one to somebody before we start. Even during allergy season or whatever. It just helps. They're more comfortable.
Yeah. Well, this has been awesome, Julie. You're like a wealth of information. I only gave you a couple things I wanted to cover before, and you had all of that and then some. So, So I wish we had hours to go. Then we could make it a full CE course. But
well, watch it. Don't tempt me with that.
Yeah, that's good.
Yeah, I love this stuff. I love it so much, and I really have a passion for it, because I see how, it sounds a little bit corny, but it can change people's lives. So it's really rewarding. So love my job. Love my job.
We like to say, each episode's an unofficial CE course in every podcast, and you definitely delivered on that. So thank you for being here. How if someone wants to learn more about XLEAR or about you, or maybe find out more about products and what they can do for their patients, how could someone get a hold of you or of XLEAR? And it's XLEAR with an X, just so everybody knows. Took me like only 5 years to figure out, it's not called XLEAR, it's called XLEAR, right? XLEAR.
Yes. Yeah, and there's a story behind that, but maybe we can cover that in part 2 sometime. But yeah, XLEAR is XLEAR.com. XLEAR.com. So if you go to the website, there will be different drop-down menus. There is a little pop-up you'll see to sign a petition to help. We want to get the CDC on board with recommending XLEAR as, prevention for different illnesses that are going around. The drop-down menus, you can find tons of research on this stuff. And then there was also a drop-down menu where you can connect to the educator team, and it will get routed to who's ever in the region you live. So like you're in Utah, if you sent an email to it, it would come to me, and I'll reach out and see, if you want to set up a CE course, if you maybe just want to try some samples before, you've never heard of this and you just want to get your feet wet a little bit, whatever we can do to work with you. Like I said, we're not in sales, we're in education. So that's where we get passionate about it. But you can find us on the website, and definitely feel free to reach out. That's what we love to do. So
yeah, if you have a good product and stand behind it, and it sells itself, right? So
it does.
Just like dentistry, I can never figure out when people are like pushing cavities and fillings and crowns on their patients. Like, if you have a good vibe in your office, people trust you, they like you, you're transparent, the dentistry sells itself. You just need to be there to facilitate it, answer questions, help them schedule, those kind of things,
Yeah, exactly. It sounds like you've got a great formula set up. If I ever move to Utah, I'll apply to work for you.
Yeah, we'd love it. We'd love it. Do it for sure. Or if next time you're out here, stop by and visit. So
I would love that.
Love to connect sometime. So thank you so much for being on the podcast. Our listeners are going to love it. Thanks for helping us, get our message out, and for the message you're sharing to help the profession as a whole. It's great.
Thank you. All right.
Okay, all right.
I appreciate it. Thank you so much.
Yeah, thanks, Julie. Appreciate it. And for anyone listening, go to iTunes, leave us a review, share your comments, good or bad. We love to hear it, and look forward to hearing from you. So thank you.